So there's some things you need to know when you come to implementing NHS Pathways within your service. The first thing is it's a big project, and it's a big project that's going to need direct project management with a dedicated personal team to be able to deliver it. It isn't just about implementing a technology or a triage system, it's about changing cultures and changing systems, and that requires engagement with all your stakeholders, both internally and externally. And in the ambulance context, that includes the emergency operational crews that are going to be expected to deliver care behind the scenes. We always talk about staff engagement being a priority in any service change and management project, but it absolutely is a priority when implementing NHS Pathways. You need to engage with the staff who are going to be delivering the service, but you also need to be engaging with the staff who work around the service. So each of those groups understands the context in which the system works. So for example, in the 999 environment, we know that possibly 1 in 10 calls are not going to require an ambulance and can be handled through alternative care pathways by accessing the DOS. But within the NHS 111 and out of hours environment, actually we might find that only 1 in 10 of those calls require an ambulance. But each of those systems and staff need to be able to understand the context and how the system works in that environment. The Pathways training programme for emergency medical advisors is comprehensive. It includes a range of anatomy and physiology and medical terminology for the non-clinician staff, and it provides a 60-hour programme which has a range of written and practical assessments that allow the staff to be confident in using the system. But it isn't just about the training programme. There's a range of post-implementation mentoring and reassessment that needs to be undertaken. And you're going to need to choose the right people to do the training. You're going to need to make sure the quality of those courses is constantly reassessed and monitored, and that the support's provided for staff when going through this process. And understand, actually, there could be a period of time between the time that you train your first cohort and when you go live with the system, and you have to have strategies to handle that. People need the confidence, and the programme will provide it. Once the training programme's finished, actually the call operators and call handlers move into a mentoring period. It's a 4-week or possibly longer period where actually they're provided one-on-one mentoring and support from trainers and coaches, have their calls audited and are provided direct feedback and guidance. And it moves the staff from the position of having done a training course to being able to operate the system safely and confidently within the live environment. Don't underestimate the training need, because it isn't just about the NHS Pathways training and the call handler training. There's a variety of other factors that you're going to have to consider and plan for, including the training around operating the NHS Pathways system within its computer-aided dispatch environment in an ambulance service setting. It's about the local operational procedures, dealing with vulnerable adults, falls referrals, and the things that make the service work within the context of your organisation. It's a big investment in people to get this right, both in terms of time, money, and the support that you're going to need to provide people to allow them to excel with this system. The clinicians that work within the NHS Pathways environment play a crucial role in managing the calls, not only in terms of the home management and those conditions which can be managed by the clinician over the telephone, but also in supporting, coaching, mentoring the call handlers who also work within the environment, whether that's emergency or non-emergency. Getting the numbers of these clinicians right is also really important, and some of the factors that you need to consider is what else are they doing in addition to the statutory NHS Pathways work? Are they providing other functions within the environment? If they are, then you'll need to increase the numbers of staff available. So the training and success of the training programme is going to rely on a number of factors. Number one, the trainer, and number two, using the peer support from around the system to help you do that, because actually you need to develop skills and experience which are real life-based skills of working within the system, and you're going to have to borrow those experiences from colleagues around the wider NHS and social care environment who have experience of working with the system. The trainers themselves need to be the right people with the right aptitudes and understanding, And we've learned from experience that those people come from a range of backgrounds. Some of them are clinicians, some of them are paramedics, some of them come from the call-taking environment, and some of them are managers. But the essential thing is to do regular reviews and feedback from the candidates and students to make sure the trainers are able to deliver meaningful training that can translate into good quality practice. You're going to need to invest in the trainers. You're going to need to select the right trainers, and you're going to have to be open in terms of where they come from. The people you're looking for are going to be able to instill confidence, understanding in the people who are going to be operating the system. They may come from a variety of backgrounds, whether it's from the call handling environment or a clinician or a paramedic, but crucially they're going to need to be supported in the early days by people within your peer support group from across the wider NHS and social care in systems who already operate NHS Pathways, because then they'll be able to give the richness of understanding what it is to deliver the service within a live environment. Choosing the right clinicians to work as clinical supervisors within your NHS Pathways environment is essential. We found from experience that you need clinicians with a broad range of primary and urgent care experience, as well as the emergency experience, because actually you need to be able to make the right judgment call at the right time and be able to understand the broad range of acuity of patients. We've got a range of paramedics and nurses that work within our environment, and together as a team we've got a set of skills which span the urgent and emergency care environment and allow us to provide the right care to patients. It's really important that you engage with the clinicians who will be interfacing and working with and around the NHS Pathways environment. For us, that's about the emergency crews, paramedics who work in the pre-hospital arena, but it's also about the primary care clinicians and hospital clinicians who come into contact with the system in its operational environment. And they need to understand what the system is and what it isn't. It's a system that provides triage around symptomology. It's got a good clinical governance background to it with the National Clinical Governance Group chaired by the Royal College of GPs, with membership from all the Royal College's professional bodies relevant to this area of practice. And it provides a framework which allows the advice to be given to patients to follow a course of action, a care plan or access care from a specific set of skills and clinicians within a particular environment. What does that mean? Well, what it means is that the system's designed to identify which symptoms and conditions can be dealt with by which people at which time and in which environment, and that is a sea change compared to the way that some systems have been operating before. The audit and CQI process within the NHS Pathways system is critical, and when you're implementing the system within your service, actually it's one of the top priorities in terms of the project planning. You need to be able to use it from the moment you go live, because the insight that you get from the audit tool and the CQI tool will tell you how individual calls are handled, individual call handlers are handling their calls, and how teams and the whole organisation are performing against a range of markers. And it isn't just one standard, it's a range of things that tell you whether the system's working as it should be and safely. The CQI tool and the audit process is a vital component of ensuring that the system is being used correctly within your environment. It's also something that provides support and development opportunities for the staff who take and handle calls, and it will allow you to benchmark both internally and externally, but also within your team structure, to ensure that the system's operating safely and you're getting the best out of it. Populating DOS is going to be really important to making NHS Pathways work. What's really important to you as a service is making sure that you've got local ownership and local responsibility to work hand in hand with the commissioners to ensure that it's up to date with the right information and that it works for the needs for your patients. The management of the Directory of Services, or DOS system, is absolutely pivotal to making this system work well within your organisation. And whilst DOS is managed by the PCTs, commissioners and CCGs in the future, actually there needs to be internal organisational responsibility for it as well. And that's going to happen by working closely with the commissioners to ensure that someone who works within your service can take control of the way it's used, because it's used by the staff operating within your service, and therefore you're in the best place to know whether it's meeting the needs of your system. Don't underestimate the size of this project. It's a big one, implementing NHS Pathways within your system. It isn't just an IT project, it isn't just call triage, it's a big change in culture, not just for your staff and the people that handle the calls and deliver services in an ambulance service context, but the wider stakeholder group and crucially the patients. You're going to need to manage expectations, communications with stakeholders, and understand that this requires robust project management from beginning to end and post-implementation to make it a success. You're going to need to have a close relationship with the Pathways team that you foster in the early days and that will stay with you both during and after implementation.